All right, guys, let's get started. Today we will be going over some common interview questions that PA schools like to ask. One of the ones that I encountered the most was just simply tell me about yourself. So for this one, you want to keep it short and simple. You want to introduce maybe where you're from, what degree you received during your undergrad, some fun facts like I've been to 18 different countries, or I like to do yoga, or play the guitar on my free time. Something that really personalizes you. Question number 2 would be why PA? Why this specific profession? What is it that is different from other professions that made you choose this? So I know the common answer that people like to use is, I like to help people. I like to work in medicine, but keep in mind that there are other professions where you can help people and be in the health field, like becoming a doctor or becoming a nurse or a physical therapist. So make sure you really understand why physician assistant. So some of the reasons may include the flexibility of moving from specialty to specialty. That's something called lateral mobility, where you don't have to go to a residency to work in dermatology or go to orthopedics after a couple of years. Something else could be like the work-life balance. It isn't as demanding as working 12-hour shifts in a hospital or owning your own practice as a medical doctor. There's just a lot of different components that could allow you to have a healthier work-life balance, but make sure you don't criticize any other occupation, but make sure that you really make it known that PA hones in on your lifestyle and what you see in your future. Also, something else could be the fact that you like working in a team setting, and PAs are very team setting oriented. They work with physicians, nurses, medical assistants. So you really need to be a team player if you do want to become a physician assistant. You can also mention something like the amount of years in schooling is something that aligns with your future goals. Let's say you want to start a family in the next couple years and med school isn't realistic for that. That is also something that could be a point. Another question that could be asked would be, why this specific program? So most programs want to know that you are going to their school or you want to go to their school for a reason. Whenever you do get an interview for that specific school, make sure that you do your research, whether that school is very high on tech and they have a lot of different kind of simulation labs that you like, or maybe their mission statement is to give back to the underserved or really working in low income communities. And if that is something that you're passionate about, that's something that you should share. So you definitely want to research the program, find out key factors about this school, bring that up when you're interviewing. So they know that you've done your research. They know that, you want to go to the school for a reason and not just because it's a PA school. It should be very specific to that program. Another question would be strengths and weaknesses. You want to have about 3 of each just to kind of be sure in case they ask you for more. You want to figure out what kind of skills and characteristic traits a PA should have, like patience, a good team player, leadership skills, being open-minded, being a people person. So obviously it's catered towards you and how you are as a person. Make sure that when you do state your strengths, you kind of back it up with evidence, saying, I'm a people person. I think that'll be really effective for me when I'm working with patients because I really take the time to get to know people, and really listen to them, make sure that they are heard and that I understand the full situation. Pick out 3 strengths and make sure you have evidence to back it up and how it kind of ties in with being a PA. Some weaknesses could be maybe you're too critical of yourself, or that you sometimes don't know how to ask for help. So just make sure that whatever weakness you choose, it's not something that's make it or break it for the program, but also just remember that you always want to make it into a positive ending. So if a weakness of yours is public speaking, you can say, but in the past, I took initiative to take a public speaking class and now I am stronger and more confident in myself, and turn it into a positive ending, because that's what they like to see, that you've kind of gone through these trials and tribulations and challenges, but you've been able to come out of it a better person. What a PA does, a PA is able to assess a patient, diagnose a patient, as well as treat a patient. So depending on the specialty you're working in, let's say you're a primary care physician, you're able to have your own patients. You're able to see them for their medical concern, you're able to prescribe them medication, and essentially by PAs coming into the health force, we're able to increase the amount of providers, which then increases the amount of patients being seen. So the overall key is that PAs play a vital role in increasing healthcare access and the quality of it. So quality is increased by the fact that because we have more healthcare providers, we're able to effectively take our time to really treat the patient and not just have a huge rush of pushing patients through in order to just kind of see them. It's like as a PA, we're able to take the time, really listen, understand the issue, and fix what's going on holistically, and not just kind of put a Band-Aid on it. The goal is not to see as many patients as possible. It's really to spend quality time. So another question, tell me about a time that you had a conflict and how was it fixed? How was it resolved? So here, again, you want to make it a positive ending. So in this question, you do want to state something that happened. How did you fix it? And what was the positive impact in the end? So a common one that I feel like is really good, but of course, adjust it to your lifestyle and experiences. But a conflict would be something similar to maybe you got into some kind of argument or discrepancy with a coworker or a friend. The main thing here is to really get to the bottom of the problem. So, and through communication. I feel like that communication is very important. It's a very important skill, and a lot of schools really do look towards that to see if you are able to effectively communicate, whether it's with your patients, your boss, your friends, or your colleagues. So if you have a conflict, let's say with a colleague, you make sure that you pull them aside privately in a respectful manner, and then you just try to fix it together. Teamwork, again, listen to them, ask them for their point of view, and then be able to talk about your point of view, but make sure that it's a respectful and mature way. And then usually the positive impact should be that you guys ended up working together very well in the long run. It was a minor misunderstanding that you guys were able to talk about. So something like that along those lines for a conflict. So another question that is commonly asked is, how do you deal with stress? How do you handle stress? So being in PA school or any grad school is going to be extremely stressful. It's going to be very rigorous, and you're going to have to be able to decompress somehow. So don't get tricked here, because a lot of schools, they ask you, how are you going to handle this program? It's going to be very stressful. How will you deal with that? So the key here is not to tell them that you're just going to pour yourself into studying 100% of the time, because that's not what they want to hear. They want to make sure that you know that it's important to have a healthy work-life balance. And what does a healthy work-life balance mean? Basically, you're able to dedicate time to studying, but also know when you need to take a step back, to take a break, to go for a run, to decompress, to kind of hang out with your friends and socialize and not burn out through studying. So that's very important, because like they say, grad school, PA school is not a sprint. You're not going to give all your energy, put all your eggs in one basket, and just hope you make it to the end. It's a marathon, and you need to go slow. You need to take breaks. You need to drink water. So that's the main thing here. How do you handle stress? Another question could be, how have you prepared for grad school? How have you prepared for this rigorous program? You can mention all of your prereq classes that you've taken. You can mention your volunteer hours, shadowing and observation hours. Just make sure that you really express to them that you are ready for PA school and you have accumulated all of these skills over the years, and you know that this is what you want to do, becoming a PA. So even if it is very, very difficult and it is a lot of hard work, this is your passion. This is where your heart lies. With all of the study habits and academic techniques that you've learned over the years, you are confident that this is something that you can take on and succeed at. Those are pretty much the questions that I have today. I can make a video in the future if you guys would like, really going a little bit more into detail about certain examples that I used during my interview experience, so you guys can kind of reflect and kind of help to figure out different examples for yourself as well. But yeah, that's my experience with that. I know this is a really tough time during the interviews, but just know that you guys are going to be okay. You're going to get through it. You just have to keep trying, put in the work, and you guys are all amazing. Becoming a PA is a beautiful profession, and I've really enjoyed my time in PA school as well, and all the years that it took me to get into school, it just made it so much more worth it. Now that I'm in it, I'm just so proud and happy to be where I am. But I do remember being where you are just a couple years ago. So don't give up, try hard, and if you guys have any questions, I'm always here. Thank you.